how to prevent kidney disease, more so monitoring. And this goes into prevention. So you want to know your numbers in order to know what the status of your kidney is. The kidneys, number one, you want to know your EGFR, that kidney number. You want to know whether or not you got albumin in your urine, so your urine albumin to creatinine ratio. So those are two important ones. But then you want to know your blood pressure. You want to know blood pressure control and make sure your blood pressure is under control in that goal. Because, like I said, that high blood pressure, like what did we say? Diabetes was number one for causing kidney damage. High blood pressure is number two for causing kidney damage. And the high blood pressure part is very important for African Americans because they have a greater tendency to develop kidney disease from high blood pressure. And there's actually a genetic marker, which we can talk about a little later on. So know your numbers, know what they mean. When you get blood work, hey, it's not just oh, everything's fine. It's like, okay, well, what is my kidney number? What's my EGFR? Is that urine albumin to creatinine ratio? Is it completely normal? Is it just a little bit abnormal? Those are things that you want to know and you want to keep track of. Okay. Other things you can do is that you want to decrease sodium intake, and this is just kind of a lifestyle measure it thing, and that is you want to make sure you're sticking to closer to a 2-gram sodium diet a day. This is just part of the lifestyle thing in general, and that seems to lower blood pressure in a lot of populations. So you want to make sure you're keeping control of that. You want to make sure that you're keeping your weight closer to a normal weight. Of course, BMI is not perfect, but it's kind of what most studies use as their marker for excess weight. So if your BMI is elevated, you may need to get that weight down. Granted, you can also do it, but we'll talk about that in the future as well. That is, because there are ways to tell whether or not all of your weight is adipose tissue or fat versus muscle. Those things are real, but we can talk about it later on because there's certain things you can do to kind of check that as well. And then keep yourself well hydrated. So you want to make sure you're doing some prevention there.